Keep a healthy pelvis using Sacrus. Preparing to conception. 3 main exercises. Preparing to conception is a topical issue now. It is worth saying that the pelvis is the principal area to be subjected to Sacrus treatment here. Seeing as the good health of the uterus, the lesser pelvis circulation, and, consequently, the efficiency of conception will ultimately depend on the good health of the pelvis. As far as the Sacrus treatment of the pelvis is concerned, it is also founded on a sequence of exercises specifically aimed at restoring normal innervation and improving circulation in the lesser pelvis organs, for stagnant circulation in the pelvis is common in many people as they tend to a sedentary lifestyle these days. Moreover, sacral area disorders can make the uterus shift out of its normal position, which not only does impair its circulation, but its innervation and the mucous membrane also, which, in turn, results in failures to get pregnant persisting for years. Here is a sequence of 2 exercises. Exercise 1 is the cat pendulum pose. Here you have to gently swing around your body, while standing on hands and knees, thus relaxing the pelvic muscles. Exercise 2 is done to provide mobilization of the lumbar region and the pelvis joints. It improves blood circulation and normalizes muscle tone. Another version of the cat pendulum pose is to keep swinging your body to the left and to the right at a small amplitude for 2 minutes. Doing so, you will be able not only to relax your spine, but also to provide additional mobilization of the hip joints, and to improve the blood circulation. Do the exercise while swinging your body to the left and to the right at small amplitudes. As far as body sensations are concerned, it feels like your hip joints are like hinges. Here comes another exercise you should do to mobilize the pelvic joints and to reinforce the pelvic floor. It is called the glute bridge. How to do the glute bridge? Lie, face up, on the exercise mat, your knees bent, and feet flat on the ground, while keeping your arms on your side, and then lift your hips off the ground, until your knees, hips and shoulders form a straight line. Hold this position for 5 seconds before easing back down. Then, lift your hips again. Then, lower them again. It is important to breathe properly while doing the exercise. Combining inhales and exhales. Lift your pelvis off the ground as you inhale, and ease it back down as you exhale. There are advanced versions of the glute bridge, where you are to project your hips as far forward as you can. When your hips are up while you are doing the glute bridge, you should squeeze those glutes as hard as you can. The next thing we are going to do is to finish the pelvic treatment and make use of a Sacrus device. Thus, you are able to provide a full relief to the sacral area, which, in turn, will relax the tense muscles and the ligaments in the pelvic region and around the sacrum. All that will improve the circulation in the lesser pelvis organs, and enhance the innervations in those organs. So, the very procedure is very simple to do. You should lie on one side, and then place the Sacrus device under your sacrum. Then, you should lower your body on the Sacrus so that its position is symmetrical relative to the device. As it perfectly fits to the sacrum anatomy, it will not accidentally slide neither forwards nor backwards. On the other hand, you are able to adjust your pelvis position relative to the Sacrus device so that it sits there without sliding off, neither to the right nor to the left. As soon as the device is there, you should bend your knees. Keep your feet in the same line with your shoulders, and bring your knees close to each other, and then hold that position for 2 to 3 minutes. This exercise provides relaxation to the muscular apparatus, the ligaments and joints that are in a state of tension. Whenever necessary, by means of the device, your sacrum may get a gentle and light correction to its position, which will also stabilize the pelvis position. As a result, the innervations of the lesser pelvis organs will be restored, and the circulation in the pelvis will be improved.
If you feel a lot of pressure, I recommend you have a small towel. We are going to slowly lift the hip, and just above the sacrus you can put it. Go back down very softly and stretch. Or, in case you have your spine very damaged, you can put a small towel over sacrus, over the device, where the small dots are. You adjust it and stretch gently.
And the fourth and the final exercise that you can do as a supplement to the sequence is the piriformis relaxation. You can do either of the two versions or both. Here is version 1, the basic version of the exercise that you can do to provide relaxation to the piriformis. Starting position, lie on your back, face upwards, and clasp the back of the thigh with both hands and bring the bent knee close to your chest as you exhale. Hold that position for 10 seconds. And then regain the starting position. Please be advised that while doing this exercise, you can feel a slight tension in a muscle located somewhere below the buttocks. That muscle is the piriformis. If you are flexible enough to do the advanced version of the exercise, you can do it as well. Version 2 of the exercise to provide relaxation to the piriformis may seem more complex, but it is more efficient. To do the exercise, you should put one leg across the other leg like this. And then bend the knee, the way you did when doing the previous exercise. Then you should clasp your hands around the back of your thigh, and, as you exhale, bring the knee close to your chest, slowly and gently. In this case, the exercise is aimed at relaxing and stretching the piriformis muscle in the leg that you lift. That is, the leg that you placed on your knee. As soon as you have reached your maximum, you should hold that position for 5 seconds. Take a moderate breath. And then try and bring the knee a little bit closer to your chest as you exhale. And again, hold that position for 5 seconds. You can try and do the third round of exercise as well. Doing it for the third time, you will keep feeling that tension in the piriformis. And it will be a bit more pronounced this time. The sensation of tension indicate that the piriformis is receiving stretching and relaxation. As soon as you are through with the exercise, regain the starting position. Do the same exercise for both legs.
Sacrus is a Russian patented device created by the same inventors as Cordus, which eliminates the fundamental cause of the spine's dysfunction. The microdisplacement of the sacrum and the base of the skull, complementing the therapies with Cordus. It's an important element in the treatment of herniated discs, sciatica, and scoliosis, among others. It may also be applied on the diaphragm and the knees. The specialized design of Sacrus adapts to the human body's anatomy. It has tips that work with acupressure and with neodymium magnets. The user just lies down on the tips of the device, breathes, relaxes, and keeps that position for 3 or 4 minutes. With each breath, the tips of the device start to penetrate the muscles slowly. This makes it a safer therapy than massage or chiropractic. Sacrum correction. Sacrus isolates and lifts the sacrum. When placed on this zone, different positions are carried out that are kept during 3 or 4 minutes. The acupressure tips of the device act on key points of the sacrum and coccyx, relaxing the deepest muscles and ligaments where neither massage therapists nor chiropractors can reach with their fingers. By this method, the correct position of the sacrum and coccyx are recovered, improving the spine's balance and eliminating, from the origin, dysfunctions and pains. Why is it necessary to correct the position of the sacrum? Most people have a deviated sacrum or coccyx caused by falls in childhood or sports falls, due to their sedentary lifestyle, a trauma during pregnancy, or at birth. Although they do not realize it, the microdisplacement of the sacrum causes a constant and strong tension in the spine that over the years triggers serious conditions, such as herniated discs, sciatica, scoliosis, intervertebral disc degeneration, knee and hip pain, among others. The treatments for these diseases will not be effective if their origin is not attended, which is linked to the bad position of the sacrum and the atlas. For specialists, the correction of the sacrum is a difficult task, since it is a bone surrounded by several layers of ligaments and strong muscles. Usually it requires long treatments and outstanding medical skills to correct it. Atlas correction. Sacrus fixes the base of the skull with a slight stretch of the neck. This soft pressure and stretch that is made in the cervical zone helps to unblock the zone and to recover the correct function of the atlas. Therefore, the good functioning of the nervous system is improved and the blood circulation that feeds the brain is regulated. Diaphragm correction. It's carried out laying on your stomach. The acupressure tips of the device penetrate in the zone of the upper stomach in a soft manner, unblocking the tensions that affect the normal functioning of the internal organs. Application of Sacrus in other zones. With Sacrus, you can make an osteopathic discharge of the dorsal zone for the correction of scoliosis. It can also be placed on the hips and knees. Does the use of Sacrus cause pains? The correct use of Sacrus, according to the manual, will not cause any pain. The advantage of the device is that the pressure can be adjusted depending on the conditions of your back. It can be used not only on flat surfaces, but also on a bed. Sacrus has neodymium magnets, with which it is also possible to get the benefits of magnetotherapy, improving the blood circulation and the functioning of the nerves in the treated zone. It is recommended to complement Sacrus using Cordus to obtain beneficial and faster results. Sacrus is the best option to recover the balance of the musculoskeletal system in a simple way using it at home. I really liked the feeling of stretching. I did not feel the tips any aggressive. Tips are very comfortable, deep but very comfortable. I felt a lot of relaxation, especially in the lumbar area. I think it is a very good compliment. You are not going to believe this, but here is my husband as a witness. I was just carrying some pickets here. I felt pickets, and since I used this, the pickets went away. They were kind of electric pickets. I just felt chic, and I felt like chic all the time. And using this, pickets disappeared. Also, I feel very well in the sacrum zone. Very comfortable, and I also like the fact that you can place it on your head and feel the body completely aligned. You are like this in a perfect position, and I also relax more. I liked it. This device works very well. I am a therapist and applied several therapies. The sacrum is the most important zone when we have low back pain, and it worked very well for me.